Knock, knock, knock. Hi, my name's Taylor Grisham, and I'll be your student nurse today. Can you please tell me your name and date of birth? Okay, great, thank you. I'm now going to verify the provider's orders. I was wondering if you have any allergies for latex, shellfish, chlorhexidine, or iodine. The patient is not allergic to any of the allergies I've just mentioned. I'm now going to perform hand hygiene. So today we'll be inserting a catheter, if that is okay with you. This is just to help make sure that you do not get a urinary tract infection. You could also help if you have a hard time getting up and going to the bathroom, since you did have hip surgery not too long ago. So we just want to go ahead and put a catheter in to help ease your pain or any discomfort you may have because you have to urinate and are unable to. I am also going to be touching your private area, your perineal area, by cleaning it. And if you have any discomfort or anything, be sure to let me know, and we can take care of that as it happens. I will also later on. I will also be removing your catheter. This just may be because you don't need it anymore, or you are having an easier time going to the bathroom by yourself. So yes, if you have any questions, you are always free to ask me at any time. You can stop me at any time I'm doing this. Just feel comfortable, and I'll get started if that is okay with you for me putting in a catheter. All right, the patient gives me approval to put the catheter in. So I am now going to raise the level of the bed to my hips. I'm going to also assess the patient's bladder for bladder distension. I see no signs of bladder distension. I am looking at the perineal area. I see no signs of redness, swelling, any discharge. I also see no signs of skin breakdown. There's no rash or open sores. All right, I would like for you to please lay on your back, put your knees up, and kind of open your knees like a frog would do. All right, now I'm going to lower your head and your back to the lowest you will allow me to go. So just be sure and tell me when you are starting to feel uncomfortable with this position. All right, I'm going to perform hand hygiene, and I'm also going to lower the side rail on the side that I will be working on. All right, I'm now going to remove the sterile catheterization kit from the clear bag. Wait, shoot, I just thought of something. Oopsie, I just messed up. Okay. Going back, since I'm pretty sure I have one of those, I am going to remove the kit from this clear bag. This will be my trash can. I'm going to provide hand hygiene again. Okay, great. I can't see. I'm trying to do this as well as I can. Okay, I'm now going to make sure that it's facing the right way. I'm going to go away to side, the side, and toward myself. I'm going to turn. This is not working very well. Okay. Alright, after doing this, I'm going to put on my sterile gloves. I had these on and I don't really know how to fold them back up, but I would be grabbing from the wrist area, making sure not to touch the inside of the glove. I mean, from the, never mind, I can't describe it. Alright, for this one, if I had not opened these, you would grab from underneath, since this hand is sterile. Okay, my hands are now sterile. I'm going to throw that away. Okay, I am going to make sure that my right hand is sterile throughout the entire procedure. Alright, I'm going to put the catheterization kit right between your legs. I would like to inform you again that I will be touching your private area, and just let me know if you feel any discomfort or anything that may cause you to want me to stop. With my non-dominant hand, I am going to, I'm going to open up my catheter. Wait. What am I doing? Oh, I was just grabbing the wrong thing. Okay. I'm now going to put this here. I'm now going to put this. Clean. Oh, other way. Alright, I'm now going to use my non-dominant hand, and I'm going to spread the labia majora. Okay. I am going to pour betadine into the trash. Alright, I'm going to make sure that this cotton ball is dipped into the solution with betadine. Going to go on the outside of the lip and the right side of the lip. I'm going to throw that away. Going in for another, going on the left side, throwing that away, and going in the middle, from the urethra or the ureter all the way down to the anus. Okay. After doing so, I'm going to grab the catheter. I'm going to hold it about 1 to 2 inches away, and I'm going to lubricate the catheter. Okay. I am now going to let the patient know that they are going to feel some pressure, so you might feel some pressure coming up. I'm now going to insert the catheter. If you would just bear down. All right, I see a squirt of urine. All right, and I'm now going to put it in about 1 to 2 more inches in. And I'm going to insert the saline. Okay, I'm now going to fill up the balloon. I'm going to throw that away. Okay, after doing this, I am going to release my hand from the urethra, and I'm going to gently pull on the catheter, make sure that it is in there. Okay, it is in. I am now going to raise the side rail and take off my gloves. Put a discard of them. I don't want to waste, get them all messed up. If we were in a real hospital setting, we would have extra gloves, and I wouldn't have to take these off. They're like this. I would just throw them. I would do it sterilely. Okay, after doing so, after doing this, I'm going to perform hand hygiene again. Performing hand hygiene, I'm going to take the catheter out of the bag. I would strap this to the patient's leg, not too tight, not too far from the body, where they are able to get up and walk around without it pulling on their catheter. I'm also going to attach the bag to the patient's bed. I would hang it from the side in a place that it won't pull or yank if they try to move their bed. I would clean and dry the perineal area thoroughly. Okay, now I am going to, that is all for putting in the catheter. I'm now going to take out the catheter. Okay. So, I am now going to take out your catheter, which means I will have to expose you if that is okay with you. Okay, great, thank you. I'm now going to remove whatever I have secured, like tape or anything, from the leg that's holding the tube in. I'm now going to, if I had another syringe, I would, but this is the only syringe I have, so I'm digging through trash. Wow, very sterile. Okay. So I am now going to attach a syringe and deflate the balloon. Okay. After deflating the balloon, I'm going to remove the catheter slowly. Okay, I'm now going to remove your catheter. You might feel a little pressure. Alright, great, thank you. I would not discard this. And if I was going to eat a urine sample, I would have gotten a urine sample before I taped the bag to the patient's leg. Sorry, I'm not going to perform hand hygiene because I just touched my eye. I'm just making sure that I didn't miss anything, did I? I'm not gonna go back because I just realized I forgot to put sterile gloves on. So I'm going to put sterile gloves on right now. I don't have any. I would put sterile gloves on, but I don't have any more like ready to go. So I would open and I would have my sterile gloves on. Sorry, I'm so sorry. It's a little hard right now. Okay, so I would have my sterile gloves on that entire time when I was taking out the catheter. Okay, I'm now going to take off my gloves, throw them away into the right receptacle. I'm going to perform hand hygiene. I'm now going to raise the side rail. I'm going to perform hand hygiene again. I'm going to raise or lower the bed into the lowest position. I'm going to lock the bed and I'm going to make sure the call light is within reach of the patient. I'm now going to perform hand hygiene. Oh, and I see no signs of blood or mucus or